AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome, South Florida and the rest of the world. And we got to be very, very thankful, all us residents of South Florida, that we really missed the storm, a horrendous storm. It really hit the Bahamas. My friends have been calling me from the Bahamas how bad it is. Tonight we have a very, very special guest, something very unusual for us here at Live Healthy and Longer. We have George Soria. George right now is the president and chairman of the board of a nonprofit organization called 47 Reasons for Healthcare Movement. George, explain what you basically are doing with the 47 nonprofit organization that you have.
Yeah, I started many years ago, and 47 when the Obamacare was coming out at that point in time. And one of the things we were looking at basically was to see what the problems are in healthcare. And because there were 47 million uninsured, that's how the name came about. Those 47 million uninsured.
Interesting.
And we were set out to do a program and open a facility at that time for those uninsured and for the people who needed care. What happened is, with the law came through and went through Washington and everything, and seemed that everyone had their mind set, so nothing was going on with any new ideas. So we sat back and we basically just spoke with everyone and sat back and watched what they were doing. And as time has come now, it's the opportunity to offer our model that was not, basically we're not able to offer at that time.
You know, I've been speaking to George for the last couple of weeks, and he's explained to me what he's doing. And I always had that dream myself. It was a wellness center. I mean, there's certain people who really believe in holistic medicine and wellness prevention prior to going to a physician. You know, when you go to a physician when you're sick, but if you don't get sick, you don't have to go to a physician. Is that right, George?
Well, the idea is to stay as healthy as possible.
Stay healthy, right, stay healthy. So you go to a yearly checkup. When you go for that yearly checkup, you're in perfect health. And how do you plan on working this? I understand you're going to be opening your first center.
Yes.
First full-blown center. It's a large center, 3,800 square feet.
Yeah, what we're doing is, like I said, now time's come, since one of the things we had working against us was this penalty. But now that this year there's no penalty under the Obamacare, so it opens up the opportunity for us to begin. And so what we're doing is basically, the idea is simple, very simple. Give basically preventive care, because everything begins with prevention. So we give preventive health care to everyone that needs preventive care. The purpose is, if we can take an individual and get his blueprint and go through all the standard medical AMS standard exams, and we can also then apply his DNA and all the latest technology, as well as all the holistic approach for both Eastern and Western, you can get a pretty good picture, a pretty good blueprint of where your health is. And then from there begin what treatments and choices the patient wants to do for his health.
So what you're really going to do is you're going to really analyze the patient's total needs, whether it's diet needs, whether it's whatever needs he may have, after what you call a blueprint. Now, it's a blueprint. Does that mean you're taking a blood test and you're doing all these?
Correct.
All these necessary things to find out what it is?
We're doing the blood. We're doing all the necessary tests that are required from a physician. There will be a physician.
A medical physician.
A medical doctor.
Okay.
All right. And then with that information, then we're also going to be able to do a DNA testing as well, and to find the nutritional aspects of the individual. All right. As well as get a complete picture of his health. Now, from there, we can then detect what's wrong. And then the patient chooses the treatment that he wants to follow. All right. So it's not necessarily our choice. It's necessarily the patient. Now we educate them in knowing that there are other sources of treatment. For example, the holistic approach. And a lot of people, Lou, it happens so many times that someone receives a prescription, they say, "Okay, doc, I'm going to take it," and they don't take it.
Especially today with the craziest opioid problem we have. Everybody's seems to be overdosed with medicine.
Yeah.
Whether it's prescription medicine or they buy medicine over the counter. And what your whole concept is, if I understand it correctly, your concept is you're going to stress a lot of it on natural stuff.
Correct. The all natural. However, we do believe in acute care, and we do believe in medicine, and there's good medicine. But the question of the matter is, in the long term, the person has to himself look at being a holistic approach. Why? Because we understand, and everyone knows, the body does heal itself. All right. And sometimes when we take some medications and take too long medications, we're treating the side effects and not the illness. And so we want to avoid that. We want to give the person the opportunity to treat himself 100% and his choice.
So you work on the whole thing, the spirit, the mind, and the body. You work in that whole triangle thing.
So
the body stays in harmony.
Correct. If your body's in harmony, everything else falls in place. And if you don't, and again, if something's not working, it's nice to know it's not working, not just keep assuming and taking something that's not working, which then creates other problems.
And if you diagnose a patient, if a doctor diagnoses a patient with say a lung disease or some other kind of disease, you will also send them to the right kind of physician to treat that, as well as the holistic side, right?
No question. That's why the medical exists.
Right.
We're not saying that there's no purpose for the medical doctor. On the contrary, you have to have both.
So you really have medical doctors referring to you too.
That's correct. We're asking the professional, the specialist itself, if they can allow us some block of time, to treat our members, to treat the people that we find and we're referring to, so that they can also be conservative in the cost, but at least get the best care possible.
Yes. So today, as you know, we have a tremendous obesity problem, which is causing diabetes and other ailments. So you're going to be looking at that, and you're going to be even change the person's lifestyle on his nutrition, his mental capabilities, etc., his way of thinking. So your whole concept is to basically take this individual on a holistic side, I believe, and treat him how to eat properly, or the proper foods, and maybe some of the foods he's allergic to he should be eating.
And you see, and the important thing is, how do we get that information? How do we know? Right now, if you go to any different facilities or anything, you really don't know what the body requires.
Well, how are you going to do it?
Through the DNA testing.
Oh, through your DNA testing.
That's correct. We're through the DNA tests are going to be able to tell the patient what nutrients his body lacks, how we can refurbish those nutrients through supplements, how we can help them get back so that he has optimum health. His body is working as a strong working machine.
And I understand you have a farm out in Palm Beach area, correct? The Wellington area?
Yes.
Yeah, you have about 20 acres where you basically 5 to 10 acres where you're growing foods.
We have 5 acres. Then we worked with other people, other farmers, which you always invite to come, that's growing healthy food to work with us so that we can provide the food to the patients.
And you show children, you bring children there to show them how to eat properly?
Yeah. Our concept on the 47 million reasons is three steps. The first step is education. We have to educate people. People have to understand that the mind, body, soul all works together. We're not fragmented people. The second is basically understanding the optimum care. We want them to understand the optimum care in the facility, and then the food. So when you educate, you provide the food, and then give them a place to go. Those 3 things make a big difference, because I've seen so many times that a patient has to wait to see a doctor, has to wait to do things. You can't wait to get healthy. You have to work at it.
So you have now the name of the center is going to be. Give me the correct name of the center.
The center is going to be called Wellness and Optimum Care Center. Optimum. We want to reach your optimum health, and we care enough to keep the cost as affordable, as reasonable as possible.
And you're going to be opening that in November?
November 1st is our target date, because this is the time where everybody has to make decisions on their health care. And we will look for everyone to start making a commitment to good preventive health.
And George, that's at 4800 State Road 7 you're going to be opening that,
That's
right?
great, in Lauderdale Lakes.
Lauderdale Lakes, 4800 State Road 7. That's one block south of Commercial Boulevard on State Road 7, 441 in the Headway Plaza. And listen, it's a great facility. I've seen the facility. It's 3,400 square feet. It's a large facility. It enjoys a tremendous amount of exam rooms. It's going to have what's the staff going to consist of? A professional staff?
We're going to have a medical doctor, of course, a practitioner, nurses. We do reach out and seek out for medical students. that are graduating, at Nova University or other medical schools, because we want them to work with a senior doctor, all right, and understand the medical side. And then we're also going to have their acupuncturists. We have physical therapists, as well as some chiropractors and so forth. We're actually having a team of doctors and technicians,
nutritionists,
that work, as well as nutritionists. Yes, very important. And we're even considering a vision as well. So we're trying to make a complete a person to walk out there and basically know where they're standing. And I think that's so important, as where their health is. And then have them come back, take classes, seminars, have them come back and work with their other community peers, and let's get healthy. Let's get back to where we're supposed to be.
Yes, I told you this was going to be a different show, and usually the healthcare profession, he takes insurance or take private pay. George, I believe that your operation is a nonprofit, correct?
Yeah, we're a 501c3, and we actually have our own fund, a donor fund. That people can donate to, and you can help support the cause, because we are community based. It's for the community, and we are basically under the National Christian Foundation have our own fund. It's called 47 Million Reasons. All right, single charity fund. You can make donations, and that's how we continue to generate revenue and continue so we can grow.
So you don't turn down anyone. You're a 401c situation where people come in and talk to you, and you'll give them a free visit to see how center works.
Yeah, we're going to be doing health fairs, and every week we will be doing actual health fair. Bring foods, fresh food from the garden, so to speak, and we'll also be there working with as many people who would like to learn prevention. We do, though. You have to be serious a member to practice prevention. We're not there to just give miracle marijuana prescriptions or any of that stuff, or follow the normal course. We're there to educate, show them the proper nutrition, and also work a game plan for their health to improve.
So today, as you can see, we have a large problem, right? Diabetes, obesity, other diseases which obesity causes, and so you're going to gear that individual. Whatever's bothering him, it could be physical, it could be mental, it could be a number of things, that you're going to treat the individual as a whole. Am I correct?
Yeah, we have to treat it as a whole. If you want to get to your optimum health, you have to get to a whole. Even counseling, sometimes 80% of the problem is because of stress, is because of family difficulties and so forth, and the body's reacting to those issues. Not necessarily it's something that's just happening. So we can solve one problem, we can improve on the others. One of the things that you mentioned, and one of the things we focus on, is small business owners. Small business owners, you name it, they go through everything from stress, divorce, marriage.
Tell me about it.
They go through everything, and yet they sometimes, and it's amazing that the amount of owners out there don't have proper coverage. So we challenge the owners of all businesses in South Florida to come in and get their preventive exams, get to the point so they can stay healthy.
George, we're going to take a quick break for a little commercial. Got to pay for this show, so we're going to a little commercial, and then we'll come right back with George Soria.
All right.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. Puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
I'll look at you, the camera. They're looking at the camera.
Welcome back. George, how can people get in touch with you? I can see the phone number here is 954-233-0767. Is that correct?
That's correct. Yeah.
That's 954-233-0767. Or they can email you at gls@47mr.org.
That's correct.
That's email at gls@47mr.org. George, how did this whole thing come about of you doing in the wellness? I know you were in insurance at one time, and you probably saw all these ailments. I remember talking to a physician once, and he said, he was a radiologist. He said, Lou, I treat all these diseases, but, time has come when we got to find out what causes these diseases. And he went into what he basically went into living longer as far as health, and he went and he got his a degree. He really got a degree in anti-aging. So people want to prevent aging. Well, if you eat properly, you'll age properly, correct? So
we are what we eat.
Eating, if you are what you eat, right. Tell us how you really got into this whole concept of you wanting to get into this wellness center business.
Well, I consider more of a mission than anything else. I spent 40 years in the insurance industry. I still am there as a counselor and helping people, make the right choices in the healthcare and so forth. But one of the things that I constantly see, and I've been through the system so much, is that people have to understand that the insurance business is in the insurance business to make money. Okay, and so what happens is when you can't afford health care, then what? Then what do you do? Where you go? And then what happens is when you get these large deductibles, then you don't go when you need to go. And you figure, well, it's going to cost me too much money. I'm paying too much in premiums. I'm paying too much in large deductibles. I'm paying too much. So you just don't go. And that's the worst thing that you can do, because then when it hits you, it hits you. Myself personally, I went through that same thing, being a business owner, small business owners, running an agency and so forth. You just keep pushing it along. The kick the can, and eventually it'll go away. But it doesn't go away. It comes back with fury.
It's like a car. Keep driving, don't put oil in it, gas, and it stops
eventually
running.
The engine burns out. So we are a machine. And so basically how I got involved in is knowing the problem. We said, well, what's the solution to the problem? And that was the key. Where is the solution? How can I make things better? We can't allow this. And so then is where I was, and as mentioned, I was at a symposium far away in Washington, D.C., looking for answers. And 3 o'clock in the morning, I decided I was tired, exhausted, up 24 hours, and all of a sudden it hit me, this idea of this model that I wrote. And I don't even remember writing it, but sure enough, I spent the 24 hours to 36 hours writing, finally made it back home to West Palm Beach, and then I passed it on to a good buddy of mine to correct it. And when it came back and he looked and said, George, there's nothing I have to correct. And when I finally read it, I said, oh my goodness gracious. This is unbelievable. And that I didn't want to even do it, because I know that the insurance industry would not like what I'm doing. Because what I'm doing, in essence, is taking away the claims, all right, and giving the care with the patient and doctor, joining them together and getting results, because this is based on results. So we don't have to go crazy with upcoding and all this other nonsense that happens in the industry. We're wiping that out. Let's just be the patient and the doctor, and let's go begin with the blueprint. Once we know that, we can move forward.
George, me being in the medical business, I say it every day. I see people say, well, they got this new thing coming out now, starting, I think, October through December. There's new whole insurance programs. You're going to see the Humanas of the world, the Aetnas of the world, all these HMOs. I think they call it a Medicare Advantage plan, which is HMO. And the HMO originally meant Health Maintenance Organization, right?
That's correct.
Well, if it was health maintenance, why do you need to pay for insurance? I mean, they ain't maintaining your health too well.
Well, with the Medicare Advantage, people have to understand this, and this is what essence. When you go from Medicare to Medicare Advantage, you give up Medicare, and now you're under.
Say that again for people listening. They give up their Medicare.
They give up their Medicare,
but they're not told that.
No, they give up their Medicare, and now they're under the insurance company's rules and regulations and their policy. They're not under the federal government anymore. So that's a big shift. So when you look at your rights under Medicare, where Medicare, you can go everywhere. It doesn't matter where in all 50 states you get
95%
treated.
of the doctors run Medicare.
Okay, when you go and shift to Medicare Advantage, now you're subject to the insurance company's network, their regions, and where they say you must go. And that's a problem a lot of patients, or in this case, a lot of people don't understand. So when you look at it, it's understand that your doctors belong to that system, because if they don't, you're not going to be treated.
And we see more and more doctors going to the holistic side of medicine too, as well as practicing conventional medicine. So explain to our listening audience, when you mean holistic, what is is that an Eastern term? What does holistic mean?
It's funny you bring that, but holistic medicine was medicine before it became Western medicine.
Oh, really?
Okay. In the early 1900s is when we made that shift, when Big Pharma came in and all that shift to Eastern medicine. But prior to that, all medicine has been holistic. All right. But it seems more profitable on the Eastern side. So, because holistic, there's no money. In the old days, we go back. There's certain herbs, there's certain things that can be grown, that can be treated for certain ailments, and it's free. It's absolutely free. So that doesn't make any money. So what we do is we try to package it or put it in a certain way that we can sell it to make money. And so that's what happens with sometimes of a lot that's going on today, because you can grow your own food and eat, right? But that we choose to go to the supermarket and buy it. But if you planted if you cut the head of your a pineapple, to give you an example, and you put it in buried in the ground, okay, and you wait about close to a little less, maybe 8 months or 9 months, you have a pineapple. All right, but it's easier to go to the supermarket and buy it and spend $3 or $4 for it. So the point is that everything's been given, except we choose to be so convenient that we'd rather pay dollars for it.
George, you just bring up. I just remember growing up, and my granddaddy, he old timer, he sort of was retired. He planted his own farm. He had 4 or 5 acres he planted, and we ate year round whatever he grew.
Right.
Whatever he grew, we ate. We had chickens, we had fresh eggs, we had year-round. He used to can tomatoes, can pears, can peppers. We had fruit trees.
Right.
The man lived to 95 years old. He drank a quart of wine a day, right? Yeah. And he'd have raw eggs in the morning with brandy. I don't know if that was holistic, but I'll tell you, he lived healthy to 95. He had no ailments.
Well, that's the point. The body and the earth are connected. And I've always learned from the hard way, the saying, we come naked and we leave naked. That's a fact of life. Everything else in between don't matter. So we come to that realization that we have to start looking to eating healthy, growing our own foods. And that's why the older generations live so long. There was no chemicals in the foods. I think it was all homegrown. It was really good food. And that's why now you're starting to see communities open up gardens and so forth, community gardens and so forth. People are trying to get back to that. But the sad thing is that we're starting a little way too late. We missed a whole generation. And so now when you ask the millenniums, or you're looking back and you ask the 6-year-old child today, where does the tomato come from? You're shocked at their answer. They don't say it comes from a farm. They say it comes from the supermarket. So we need to change, and that's what the center's about: educating about food, educating about everything we do, so we get back to that holistic approach.
I think what George is saying, in so many words, you can keep your regular physician, but visit the wellness center, because the regular physician will probably treat the ailment that you have, but George is going to treat the cause of it. Am I correct, George?
At least
try to get to the cause of it. So and the factor is, going to the center, at least you'll know how your body's reacting. But I'm going to be one of your first patients. I want to try it.
Listen, the business owners direct it. If the business owners support the community, then the community is there for everyone in the community. Because the business owners have to support the community for it to be successful. And that's why we ask the business owners, come in, support the community, see what we do, experience it. And, the other thing we didn't even mention, which essence, because with time, every patient after that first visit, can have a virtual office. So therefore, we don't have to keep coming back. And we can monitor your health for your success to see
your
that you
home.
improve from your home.
Fantastic. But that's we're really going places, and I can tell you, everyone should really know more about their body, especially young children. George takes kids to his farm, he shows them the fruits and shows them how to eat. If young kids are in school, they're in elementary school, they have field trips. The seniors should take some field trips too. I know a lot of seniors go to a fresh open market, or they go to Whole Foods and buy fresh fruit, or they go to the Publix and buy organic foods. Well, George is telling you, there's some foods you're allergic to. Like, I don't even know what you're allergic to. Folks, it's time to go. They're telling me I got to get off the air. George, it's Tremendous Avenue. Want you back again.
Okay, thank you so much. Thank you all for having me. And don't forget, 954-233-0767. If you have any questions that you'd like to ask, feel free to call.
Thank you, folks. That's it.
Longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.